My name is Stefano Cotrufo and I'm a plastic surgeon in central London, Harley Street.
Today I'm having brow lifting, I'm having mid-face lift, I'm having lower blepharoplasty and exchange of breast implants. I met Dr. Cotrufo several years ago and I decided to go for my first breast augmentation after my first pregnancy. And I visited quite a few other surgeons and read like hundreds of reviews on the internet. Once I met Dr. Cotrufo, I was really impressed by his professional approach. He explained all the details of upcoming procedure, and I was extremely happy with his confidence. He made me feel quite at ease and was straight to the point, so that's how I decided to proceed with him, and I'm extremely happy with the results. So when it was time for me to make a decision which surgeon to go for my second surgery, it was obvious. So that's how I'm here now. He is very professional, he is very patient, he explains everything, all the details. I'm impressed by the results as well, and I think he's a fantastic specialist, and I'm very happy to be his patient.
The idea is that so the selection of the technique of a lateral temporal approach rather than a brow lift, also with incisions in the middle, is that the ideal shape of an eyebrow often we talk about the option to correct the tear throw. Certainly hyaluronic acid is an option, but surgically we have so many more options that are available, and I think even more powerful and more natural, because we can either transpose the eye bag, which is the preseptal fat, that is what is more towards the eyelid margin, and we can move this inferiorly, and there will be a natural and permanent filler for the tear throw. We can combine that with the lifting of the mid-face, which will create an even softer and bulkier correction. Surgery certainly is more invasive and requires a longer recovery time, but it gives options that are more versatile, lasting much longer. La call Steven as soon as we finish. So this is the first stage, which is the opening through the same incision, and then expose layer by layer the implant. So the capsule, as we see it here, is extremely thin, which is an excellent thing, and the reason is that will give me enough space to insert a larger implant as you want. The implant that we selected is something that has the same dimension side to side and north to south. So basically we repeat the same footprint of the current breast, but with more projection. This stage the capsule is open, there is no fluid, which is also another excellent sign, and the implant is completely intact, maintaining its shape. So this is a very, very interesting stage of the procedure, because by removing the first implant and leaving the one in place, we can see how well settled the result was after our original breast augmentation, but also we can see what was our original initial size. Okay, so this is a very important detail at this stage of the procedure, because as we go on layer by layer through skin, fat, subcutaneous tissue, and then eventually the capsule. The capsule is done on several layers, but this last one that is the most adherent to the implant is extremely thin. So it is essential to slow down at this stage of the procedure in order to open this layer gently and avoid any injury to the implant. So we can start seeing the implant that is very well adherent to the capsule. Scissors, thank you. So now I can proceed with the blunt dissection, opening the capsule on both sides. And again, it's all very dry, which means there is no seroma around the implant, and so we don't have any concern for the ALCL, which is then a plastic large cell lymphoma. That is the most recent new evolution of a complication from textured breast implants.
Yes.
Okay, so the implant is completely intact. There is no leaking of gel.
I get it.
Because there was an asymmetry of the position of the implants before, then well, the left implant was a bit higher and more towards the midline. So before inserting the new implant, I'm extending the pocket more laterally and inferiorly, so that hopefully there will be a better symmetry between the right and the left hand side. Can you tilt the patient towards me, please? Okay. And let it chart it to me. This is yours. So this implant is still a bit higher, but also there is a release of the capsule. There must be some bend here that is creating this deformity. So basically the implant has more compression here in this point. So I need to complete the release in order to see the implant that becomes more round and repeat the same contour that I have on this side, but also drops in a lower position to achieve better symmetry. This is almost the end of the procedure, because the right hand side had an exchange of implant of about 100 cc's increase, while instead on the left hand side the implant was much higher. And so after release of the capsule, now I have an upper pole of the implant that is very symmetric. The nipples are in much better symmetry, and obviously perfect symmetry doesn't exist, but this is as far as it can go. But certainly having the implants at the same height is the most important part. So the reason why I prefer the anatomical implant compared to the round one is because I simply think that this type of shape is the most natural one. It really doesn't matter what is the size of the implant. In this case, obviously this is a 550 cc implant, which is a large one, and yet even with such a large implant, the cleavage between the upper chest wall towards the nipple is the most natural. Okay, so this is the end of the lateral temporal lift on the left hand side, of course. Now the plan with this procedure is to lift the lateral third and give a lifting also on the temporal area. So this is the ideal shape, but the lateral third only is higher, and the mid third is still in a similar position. So now we're going to repeat the same exercise on the opposite side, where we want to have as much symmetry as possible, probably in this direction. Throughout the procedure, it becomes obvious that the patient had a fat injection to the cheeks, which is something that probably she forgot to say. But as you can see, this is orbital fat, which was creating the eye bags, as you can see here. And then this is the SUF, which is the fat that is underneath the orbicularis muscle. And then she had a large volume of fat that is quite unusual. This is obviously fat injection, and so we're going around it. And will be part of the lift more towards the upper part of the eyelid. So here we are at the end of the dissection of the mid-face lift. This is a preorbital fat which is causing the eye bag. That's SUF, which is the fat that is underneath the orbicularis muscle. And then here we see the origin of the zygomaticus major muscle. So this is the muscle that makes you smile. So this is a very important landmark because just lateral to it, there is a zygomaticocutaneous ligament, and this is what we usually release in the plane facelifting technique. So what I'm exposing here is the preorbital fat, which is not necessarily an excess in this case, but the reason why I'm still exposing it is because I need to use this as a filler for the tear throw. So this is the fat.
Is it in a way?
As you can see, I can use it to fill the tear throw, and it's very obvious where the gap is because here she has her own fat, but instead here we are on the bone. So this fat needs to reach this corner and correct permanently her depression. So this is the end of the procedure where we performed a lateral temporal lift with an incision that is just on the hairline and the mid-face lift through the lower blepharoplasty approach. Now this volume has been lifted, the tear throw doesn't exist anymore, and just before suturing, it is very important that the skin edges are kissing, as you can see here. So there is no suture yet, but the skin edges are just kissing, which means that I remove just enough skin to have a closure without any tension, and that's one of the key elements in order to have a scar that disappears over time. Hello. So these are... Yes. Okay.
Oh, beauty.
It's been about 6 weeks and I'm feeling fantastic. The recovery has been very quick and smooth and without no problems. I'm very happy with the results.
Okay, these are healing very well. You apply Vaseline, the swelling keeps going down over the period of 6 months. So basically what you see now is not a final result. You'll see your volume that keeps shrinking. You can go and dye your hair. What I would suggest is, however, when you do that,
Meditation.
no, to apply a tape on it, if you could. Steri strips, I might have them for you. If I don't have them There are the very fine ones that are a quarter of an inch. They will fit just perfectly, or you can also split it in two. You need to dry the skin properly, otherwise they will not stick. Yeah. And then you go for it. Lymphatic drainage massage and keep going with arnica if you feel like it's something that will help you. Okay. The left breast has a tendency to go higher than the right. There is a chance that it's because the chest wall is not exactly, it doesn't have the same orientation right and left, because on the left hand side you have the heart. So the left hand side, the rib cage, is always a little bit more lifted, and so that means that whatever movement you do with your shoulder might facilitate the implant to move up. And so this is something that the longer you use it, I think the better it is, because once the capsule is formed, then there is no chance for the implant to dissect higher up, because obviously the dissection in this case is minimal, but it's still possible. So that's the only thing. What I did in this case was to make an incision in the capsule here, so the implant could drop more laterally. But as the capsule forms, it might push it back. Okay.
And how long does it take the capsule actually?
I think 3 months. 3 months in the primary case is correct. So basically, the longer you keep it, the better it is.
Yeah.
Okay.
But I still can already lift. And
Oh yeah, I think so. As long as you keep this on.
and what about lifting my elbows?
I think there is a slowly go for it.
Because it feels quite calm.
Oh yes, absolutely. Show me. Keep going. Here. Yeah. There is no point to really feel tension at all. Okay, that's excellent. Yeah. This doesn't have to be too uncomfortable, but I think that if you have a tendency for the implant to go up, that's a very good friend you have. Until the summer. Let's try.
It's been almost 6 weeks since I had my surgery. I've been very happy with the results so far. The recovery is fast, and I've already returned to my normal physical activity. The swelling has gone down within the first couple of weeks, and I'm feeling happier and happier day by day, and I definitely feel younger. Dr. Cotrufo is very professional and fantastic surgeon. I'm very happy with the results.
Thank you very much for watching this video. I hope you found it useful. And please don't forget to follow me on Instagram in case you wish to know more about my plastic surgery service, and in particular if you wish to see my results, which of course I'm very proud of.